For this assignment, I chose to research learning and intellectual disabilities in relation to substance abuse. I chose this topic because I've noticed that disability topics in general seem to be underrepresented. I did take a class on it when I was going to a different college, actually, and it was really fascinating to me, I think mainly because I really hadn't learned a lot about it in the past. So, going beyond that, out of the choices, it was the one that I knew the least about research wise. So I started off as researching disability as a broad topic, and I found a lot of interesting data connected specifically to learning and intellectual disabilities in connection to substance abuse. So without even trying, I think there was just a lot of information telling me the correlation between these two is pretty significant. So that sort of intrigued me. Um, Areas of concern and misunderstanding. Individuals with disabilities are a growing population. There are 7 to 8 million people in the US with an intellectual disability, and research shows that they tend to suffer disproportionately from substance abuse. So, for many of the studies I researched, the data indicate that a majority of individuals with these disabilities do not abuse drugs or alcohol. Yet, individuals with these disabilities are disproportionately represented among those in need of substance abuse treatment. Sort of in summary with that, in the studies done on individuals with patterns of substance abuse, oftentimes a majority have some type of learning or intellectual disability. So if there's a group of people who have learning or intellectual disabilities, you really can't be sure that you're going to find a ton of people dealing with substance abuse. But if you take a group of people who are dealing with substance abuse, it's highly likely that you're going to encounter somebody who's dealing with these types of disabilities. Uh, and for as significant as the numbers are, little is known about the characteristics of individuals with intellectual disabilities and substance abuse. A lot of the data that I found was correlational, and unfortunately, it didn't go beyond this. A lot of the research that I found actually specifically mentioned this. At the end of their research, would say, we found a lot of these correlational data, the significant data, that is great to understand that there is a correlation, but really doesn't give us a lot of information on causation. Some additional risk factors that I found: the majority of people dealing with the substance abuse that have these disabilities are male. A lot of times it starts in adolescence, and a lot of times it's for individuals who are in a low income environment. Um, Recommendations for change. So I think understanding that this is a problem or there is a correlation there is helpful so that we can look for early signs. Whether that's looking for early signs in people who are dealing with these disabilities for substance abuse, it's probably more likely to look for signs of these disabilities within individuals who are experiencing substance abuse. Focus needs to be put on adolescents and understand there is a risk factor. Um, Education for the parents at a young age. This is really important, especially if you've got a child who is experiencing substance abuse, understanding that there may be some additional disabilities attached to that. There could also be, if you have a child with disability, these intellectual and learning disabilities, that they could have a higher risk factor for dealing with substance abuse later on. And education for caregivers, for those with these disabilities, but also with caregivers or people dealing with individuals who are dealing with substance abuse. Understanding that there is a relationship there. That being said, we still need to watch out for stereotyping. Majority of individuals with these disabilities will not experience substance abuse issues. So as I was saying before, there is that correlation, but it's really mainly with people who are dealing with substance abuse are going to more likely deal with these disabilities. And then just more research overall, I think specifically on the why or characteristics of these individuals. This is important mainly because it's hard to really treat these situations and understand how to help these people if we don't understand what's causing it. We can understand that there's a problem. We really need to go beyond that because it really is a significant problem at this point. And here are my references of the research that I found.